Hey everyone, this is Carrie Anderson. Hope you all doing well. In today's video, I will talk about what is diabetic ketoacidosis. So if you like the video related to my health, my way, I would like to request you all please do subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Diabetic ketoacidosis, also known as DKA, is a buildup of acid in your blood. It can happen when your blood sugar is too high for too long. DKA is a serious complication of diabetes and could be life-threatening, but it usually takes many hours to become that serious. You can treat it and prevent it too. So the diabetic ketoacidosis symptoms that is can appear quickly and may even be your first warning sign that you have diabetes. The system, which includes the dry mouth, dry skin, feeling very thirsty, frequent peeing, nausea or vomiting, weakness, fatigue, confusion or less alertness, flushed face, headache, muscle ache, sweet smelling breath, belly pain, shortness of breath. Call your doctor or go to the emergency room right away if you have any of the symptoms that your ketones are moderate to high when you test them using a home kit, or if you have more than one symptom. So you have been throwing up for more than 2 hours, you feel queasy or your belly hurts, your breath smells fruity, you are tired, confused, or woozy, you are having a hard time breathing. Now, the diabetic ketoacidosis causes and the risk factors. The diabetic ketoacidosis usually happens because your body doesn't have enough insulin. Your cell can't use the sugar in your blood for energy, so they use fat for fuel instead. Burning fat make acid called ketones. If the process goes on for a while, they could build up in your blood. That excess can change the chemical balance of your blood and throw off your entire system. People with type 1 diabetes are at risk for ketoacidosis since their bodies don't make any insulin. Your ketones can also go up when you miss a meal, are sick or stressed, have an insulin reaction, haven't injected enough insulin. DKA can happen to people with type 2 diabetes, but it's rare. If you have type 2, especially when you are older, you are more likely to have a condition with some similar symptoms called HHNS, that is hyperglycemic non-ketotic syndrome. It can lead to severe dehydration. Now, the risk factors for DKA include having type 1 diabetes even if it is undiagnosed, missing your insulin dose often, not taking your insulin as prescribed, stomach illness, infections, heart disease such as heart attack, recent stroke, blood clot in your lung, serious illness or any trauma, pregnancy, surgery, medicine like steroids or antipsychotics, using illegal drugs such as cocaine. So now the diabetic ketoacidosis, the diagnosis and test. So test your ketones when your blood sugar is over 250 mg, that is milligrams per deciliter, or you have any of the above symptom of high blood sugar such as dry mouth, feeling really thirsty or peeing a lot. You can check your sugar level with a urine test strip. Some glucose meter measure ketones too. Try to bring your blood sugar down and check your ketones again in 30 minutes. Your doctor can give you a physical exam, ask about your symptom and discuss your medical history. They can order these tests to diagnose DKA too. Blood work including metabolic panel and electrolyte, urinalysis, arterial blood gas, blood pressure, test for signs of infection, chest x-ray, electrocardiogram, diabetic ketoacidosis treatment. If you don't treat ketoacidosis, you could pass out, go into a coma, and possibly die. You should go to the hospital to treat DKA. There you will receive emergency treatment like insulin through an IV to bring your ketones down, fluid to get you hydrated and bring your blood chemistry back into balance, electrolyte replacement through an IV to replace key minerals like sodium, potassium, and chloride to keep your heart muscle and nerves working properly. If you have any infection, antibiotic. If your doctor suspect you are at risk for a heart attack, a further heart. Diabetic ketoacidosis complications. that are possible if you don't have emergency treatment like electrolyte replacement and insulin. They include low blood sugar or hypoglycemia, low potassium or hypokalemia, brain swelling if your blood sugar level are adjusted too quickly, loss of consciousness, death, diabetic ketoacidosis prevention. Your doctor may change your insulin dose or the kind you see or you use to prevent DKA from happening again. So the good blood sugar control will help you avoid ketoacidosis in the future. Make sure you manage your diabetes through your diet, exercise, medication, and self-care. Now, the steps I will be going to telling you, which you need to follow, which will help you to prevent the DKA. That will be the drink lots of water or sugar-free or non-alcoholic beverages. Take your medicine as directed. Follow your meal plan closely. Keep up with your exercise program. Test your blood sugar regularly. Check for expired insulin. Don't use your insulin dose if it has clumps. Insulin should either be clear or evenly cloudy with small flecks. If you're on insulin pump, look closely for insulin leak and check your tube connection for air bubble. Now, I want you to talk to your doctor if your blood sugar level are often out of your target range. Manage your insulin dose with the help from your doctor or diabetes coach. Make adjustment based on your sugar, blood level, what you eat, activity level, or during any illness. Now, you need to create a DKA emergency plan if your blood sugar level are too high and your urine has too many ketones. Make a plan to go to the hospital. So that's all about the DKA in this video. I hope you all liked it. And for that, I personally prepared a presentation, a very small presentation for all of you guys. And I'm sure that will be going to help you a lot in order to overcome the diabetes. So you need to just look forward, and I'm going to share the link in the description box below. You can check it out from there and take advantage out of it. So that's all. I would like to request you all, please to like, share, subscribe this video with your loved ones so that they can also gain their knowledge about this. So that's all. I will definitely meet you in the next video with my other content. Till then, have a blessed day with your loved ones. God bless you. Bye bye. Take care.